Hi, Nelson.
Yeah, all right. Samuel, you could confirm whether I'm being heard.
Yes, Nelson, I can hear you.
All right. Yeah, thank you. I welcome you all to this NASMEC webinar, which is a precursor, one of the building webinars or one of the building events to the National Safe Motherhood Conference that is supposed to be held in October from 22nd to the 25th of October. And the previous conferences that we've been having, as you well know, this is the 50th conference. Some of the recommendations that we are getting was that we needed to take people through how to come up with abstracts, how to write catching abstracts, how to write abstracts that have impact and that can be presented at the conference, really. On top of that, we were getting lots of abstracts that were submitted that were not to that point that you would expect or you would want to be presented at the conference, but yet things that have been, the abstract that would have been submitted would actually have made sense, would have actually made some difference at the conference. So that was a background on why we needed to have these training sessions, basically on how to write abstracts, on how to come up with abstracts, such that we can get people write something that is of high quality and of standard. And yeah, I thank you all for joining today's webinar. And the individual that is going to take us through today's session is going to be Dr. Sharon from FHI. She will take us through today's session. We are going to have an interactive session after Dr. Sharon taking us through. At the end, we shall have a Q&A interaction where people or colleagues or attendees who are in this call, you will raise your hand and ask question as for the clarification you'd want to get from Dr. Sharon. Yeah, from now, I'm going to hand over to Dr. Sharon. We are supposed to have opening remarks from Dr. Andrew Odul. However, given that he's a hospital director of Lira Regional Referral, he's quite a little bit taken up. He informed me that he has quite been taken up with the hospital duties, and he may not be able to join us for this webinar. But I now hand over to Dr. Sharon to take us through today's presentation.
Thank you, Dr. Nelson. I hope you can all hear me. I'm just going to share my screen now. Okay, let me see if you can see it.
I can hear you.
Okay, can you see my screen?
Let me, you can share now.
Okay. All right. Okay, is the screen showing okay?
Yes, it is.
All right, great. So thank you for having me. My name is Sharon, and I was a former senior advisor for FHI 360, but as you all know, many of us were let go. But I'm still here. I'm happy to do this. So today's session is how to write a program abstract. And there are 6 parts to what we will talk about today. The first is, why even submit an abstract, right? And then we'll go through, what is the purpose of an abstract? Then we'll talk about finding a home for your abstract, the structure of an abstract, some writing tips, and then an open forum for question and answers. So why should we participate in a conference? Conferences are an opportunity to share knowledge, such as obtaining and sharing the latest guidelines, evidence, innovation, and best practices. It's a forum to network and collaborate, to brainstorm and find partners to work on groundbreaking solutions and strategies, as well as to advocate and shape health policies. So you can actually directly shape the content of the conference by submitting an abstract. Because when you submit an abstract, you're basically giving the conference organizers a suggestion of what you would like to include in the conference. And then if they like the idea, they accept it, and then it can either be presented as an oral presentation or as a poster. So it's a pretty empowering opportunity. So what is an abstract? An abstract simply is a short and clear summary either of your research or of your work. So the program abstract is targeted maybe not at research, but of a program initiative that you've been working on. And it serves as a preview, like a sneak peek or a small portion to showcase something larger. And it gives the conference organizers and the attendees an idea of what you will present at a conference. And it helps them decide if they want to learn more about what you want to present. And so an abstract is important at two different phases. Before the conference begins, and this is sort of where we are now, at the selection and screening phase, when you write a well-prepared abstract, it helps the conference reviewers and organizers decide in which papers to accept for a conference for presentation. And then at the conference itself, once it's been accepted, it helps the attendees to quickly assess whether the presentation aligns with their interests. As you can see in the photo, right, a conference has loads and loads of people. So an abstract book, it helps them to narrow down, oh, this is a topic I'm interested in. So a clear and engaging abstract, it kind of encourages the attendees to come to your presentation, whether it's the oral or the poster presentation. And then later on, the abstract also helps the attendees to remember the key points from your presentation. So in summary, a well-prepared abstract helps the readers to identify the basic content quickly and accurately, determine the relevance of their content to their interest or purpose, decide whether they want to listen or read the presentation in its entirety, as well as remember key points of the presentation. So you may be thinking, okay, I want to contribute to the Safe Motherhood Conference this year by submitting an abstract, but how do I find a home for my topic? Or how do I find a match to my abstract? So what's really important is to align your abstract to the conference theme and sub-themes. And we're going to do this by considering 3 questions. Which sub-theme does your topic best fit under? How might you angle your topic to align with the conference sub-theme? For example, you might want to identify relevant keywords in the sub-themes, and we'll go over each sub-theme shortly. Look for keywords and phrases that appear frequently in the conference description, call for papers, or website, and incorporate these into your abstract, as well as consider your target audience. Who are these attendees going to be? And tailor your language and your approach to resonate with their interests and expertise. And you also then want to connect your program or your research to the conference sub-theme. So highlight your relevance, clearly stating your abstract how your program directly addresses or contributes to the conference theme. Don't just mention it, but explain the connection. Focus on the so what. Why is your program important within the context of the conference? What insights, solutions, or new perspectives are you offering? And if you are if your topic has an interdisciplinary part, right, emphasize the relevance to the broader conference theme. So in the 5th National Safe Motherhood Conference, the main theme is to strengthen multi-sectoral collaboration and mutual accountability for safe motherhood. And there are 8 sub-themes for this conference. So as we go through each sub-theme, start thinking, how might your topic fit in? There is service delivery, health workforce, health financing, health information systems, medical products, vaccines and technology, leadership and governance, family planning, and multi-sectoral engagement. And we're going to go over each sub-theme together. So under service delivery, they're talking about ensuring quality and accessible maternal, newborn, and adolescent health services. This includes topics on improving quality of care, strengthening referral systems for emergency obstetric and newborn care, and expanding community-based healthcare models. For health workforce, it's talking about enhancing human resource capacity for safe motherhood, addressing workforce shortages and retaining health workforce, strengthening community health worker models, and training and capacity building. Under health financing, the key focus is on sustainable investment in maternal, newborn, and adolescent health. How can we strengthen domestic resource mobilization? How do we improve financial efficiency and accountability? How do we mitigate the impact of external funding reductions on essential maternal services? And what are alternative health financing models? Under the sub-theme health information system is strengthening data for decision-making. So this includes topics like the NPDSR, leveraging digital health and real-time data for monitoring, and enhancing the HMIS for evidence-based policymaking. Under medical products, vaccines, and technologies, it includes use of digital innovations and telemedicine, strengthening the supply chain management, and expanding access to essential commodities and life-saving medicines. Under the sub-theme leadership and governance, it's about strengthening accountability, so strengthening community engagement and social accountability mechanisms, enhancing policy implementation and enforcement, improving coordination between government, private sector, and development partners, as well as improving functionality and accountability to the LMNS systems. And the last 2 are family planning. How are we, topics on expanding access to quality and equitable FP services, strengthening community engagement and male involvement, leveraging innovation in digital health solutions for family planning service delivery. And under multi-sectoral engagement, it's harnessing multi-sectoral engagement to strengthen community health for safe motherhood. So it's tackling poverty, gender inequality, education, and cultural barriers to improve health outcomes, looking at the role of community health workers to bridge the gap between facilities and communities, looking at strategies to reduce the mortality through cross-sectoral partnerships, and community engagements and ownership. So as you're thinking about your topic, think about which sub-theme does your topic best fit under, and how might you angle your topic to align with the conference sub-theme. So here's a little example. For example, if my overall topic is, say, group antenatal care for pregnant adolescents, then I think a sub-theme that it might fit under is service delivery, because I'm trying to, expand uptake of group ANC or accessibility of ANC, right, for adolescent mothers. And the way I might angle my topic depends on, the kind of data that I might have. One angle could be, how does group ANC improve quality of care? So if I have collected data, or if I have available data on quality of care, maybe on, number of ANC visits, over time or in their retention. Maybe that's something I could include. Or maybe I've been, really talking to my colleagues or documenting, how well has implementation of Group A and C been going and fitting in my service delivery setting. Maybe then I could angle it in terms of what is the feasibility of scaling up Group A and C in a high volume public health center. So really frame your topic around the conference sub-theme. So then this moves us to, how do you structure a program abstract? And this is a bit different from the research abstract. So this webinar is focusing on the program part. So these are the main components that the conference has set out. You should have a title. You should list the authors and the main contact information. And the three main sections are background, a description, and conclusion. And they have a maximum word count for you, which is 400 words. So the title of an abstract should be informative, and it should clearly reflect the content of the presentation. So what is your presentation about, and what makes it interesting? That's like a guiding question that I use for myself to brainstorm about titles. And it should be very concise, so ideally less than 20 words. And the title should be engaging and accurate, should be interesting, right? Avoid jargon so that you can attract more people, because jargon, only speaks to people who understand those words, right? So you want to be as inclusive as possible, but also keyword rich, because, I think the conference uploads the abstract books online, right? And so this is one way that when people Google it, they can search for your abstract and find your work. So one example could be, for this Group A and C, could be Group Antenatal Care for Adolescent Mothers, Benefits Beyond Attendance, Case Study from an Urban Health Center 4 in Kampala City. So the reason, I have informative here, right? Group A and C, it includes the topic. And then if I'm focusing my abstract on the benefit of the effectiveness of the Group A and C model, right? I say benefits beyond attendance. So I'm saying, this topic of this abstract is about the effectiveness of Group A and C. But I'm also trying to make it engaging. So I'm saying, we saw benefits that's more than just A and C visits, right? And then it's informative. It's saying it's a case study. So it's an abstract about one health facility coming from an urban health center 4 in Kampala City. So it's describing the setting in which, this program is taking place. So this title is informative. It's concise. I think it has exactly 19 words, less than 20 words. And so what it might draw are people who are interested in improving ANC, or people who are interested in improving services for adolescents, or it might draw people who are interested in urban health service delivery. So this is a way to, use the words in your title to bring an audience to your presentation. Alternatively, if my focus is on, the implementation aspects, right? I could say scaling up group antenatal care for adolescent mothers, challenges and opportunities, lessons from Urban Health Center 4 in Kampala City. So this focus of this abstract then is more on the implementation and the challenges maybe that I've faced in rolling out this program. So these are just some ideas of what an effective title is. So it has to be effective, has to be, not effective, has to be informative, has to be concise, so not too wordy, and try to make it engaging, interesting. Then for your author and main contact information, you list the contributors to the work. So typically in the organization that I last worked, the first author is like the person who is either the presenting author or the person who's writing it. And then you list everyone who's contributed. And then maybe the last author is like the leader, right, of the group. And then you want to have the contact information so that the conference organizers, if they accept it, they can come back to you. So what I find usually helpful is include the first and last name, your job title, your health facility or institutional name, the district, phone number, and email. Then The next part is the background of the abstract. This section is to describe the background, the setting, and the program objectives or purpose. Here, what you want to do is describe briefly the context of the public health issue being addressed and why the program was needed, like what were the gaps and challenges or health disparities that you saw? What were the clear and measurable goals of the initiative and the target population and expected outcomes? So this really brief section that just really highlights, why are you doing what you're doing and why is it important? And to make it more likely that your abstract will be accepted is to really clearly demonstrate in this section how your program aligns with the conference and sub-theme. So in the significance part, right, really relate it back to the conference sub-theme and make it align and be relevant. So for example, for the background for the example that we've been using, briefly explain why Group A and C is being considered and what were the current challenges, and then state the goal or the aim that Group A and C is trying to address. So here I say, Group Antenatal Care brings together a group of pregnant women with similar gestational ages for their antenatal care sessions. So here I just define what Group A and C is. I said this approach is increasingly recognized for its ability to promote positive behavior change, leading to healthier practices and improved pregnancy outcomes. So I'm stating what is known about the intervention. At Mirembe Health Center 4, I just made up a health facility name. Health workers serve approximately 8,000 pregnant adolescents, 15 to 19 years each month. So I described the setting, right? Like I have a very high volume of pregnant teenagers that are coming to my health facility. And then I say, however, these young mothers typically attend only 2 antenatal care visits before delivery, compared to an average of 4 visits among the older women, ages 20 and above. So I'm stating my problem, like, these young moms aren't coming for A and C before delivery. So to address this gap and improve antenatal care attendance among adolescents, Mirembe Health Center 4 introduced Group A and C specifically for pregnant youth. So then I explained here, why the program was needed. And I explained, who the target population was and what the expected outcome was, right, to improve A and C attendance. So that's like a very brief background. I explained, what the intervention was, what we think the intervention can do, the problem, and why we needed the program. So then the next section is your description. So here we want to outline, the development, implementation, and evaluation of your new service program or your initiative. So you want to describe how your program was designed and executed, and describe the key intervention strategies and stakeholders involved. You want to give enough meat to people so that they understand what you did. So here's an example. Before launching Group A and C, midwives, nurses, and the adolescent focal person and youth peer educators underwent a one-day training on group facilitation skills. So here I'm describing the preparation steps to Group A and C. And then I said pregnant adolescents aged 15 to 19 were invited to attend Group A and C on Tuesdays, the adolescent clinic day. So like I'm explaining, how I'm operationalizing this. The ANC clinic lead grouped participants by gestational age and scheduled the sessions every 4 weeks in line with routine ANC visits, and the peer educators collected contact details to send reminders. And then I said each session included introductions and icebreakers, interactive sessions on pregnancy topics, individual health assessments within group settings, peer support, and shared learning. And participants discussed challenges, shared experiences, problem solved, and received personalized counseling. And sessions concluded with key takeaways to reinforce learning and encourage follow-up. So here I was specific with the intervention. Like I described, how the intervention, like how a group ANC session went. So I gave some details in how it went. So then you move to your conclusion. So if your program has already been completed, like show your outcomes now, otherwise include the outcomes that you expect to measure. So here you can describe outcomes based on the data or observations, describe your successes, challenges, and lessons learned, summarize your key findings, and then end on your next steps for scaling, improving, or sustaining the program. So here I say, since the implementation of Group A and C, the average number of antenatal care visits among pregnant adolescents have increased from 2 to 4. So like that's my measure of success, right? Because my problem before was they weren't having enough antenatal care visits before delivery, and now that has increased. I could actually have improved this by putting also the dates, like from two to four from over a year's period of time or something. And then I said, I described the success beyond the primary outcome. So going back to the title of, beyond attendance, right? I said the group-based approach has fostered greater engagement, peer support, and active participation in health education. And participants have reported increased confidence in managing their pregnancies, while healthcare providers have observed stronger rapport building, improved adherence to care recommendations, and a more supportive environment for young mothers. So you're kind of adding to like why you think these why you're seeing like improved ANC attendance, Then you summarize the key takeaway. These findings underscore Group ANC as a promising and practical strategy for enhancing maternal health outcomes among adolescent population. And then I talk about my next steps. To scale and sustain Group ANC, efforts will focus on expanding outreach, training additional health workers in group facilitation, and securing long-term funding. So this overall, ends on like, what will you do next? So overall, this is just like a screenshot of what the abstract would look like. And really to get to this point, you have to edit, and keep rewriting it to make it more concise, like taking out words that are useless, right? Rewriting things to make it clearer, and always going back to the conference theme and sub-theme to think, how can I better align this to make it more clear, or to speak more to the theme? What words can be more impactful? And so you keep playing around with your sentences till you find something useful. And then you always double check for word counts, spelling mistakes, and grammatical errors. So then overall, this whole thing was 320 words out of the 400 words. So it fit, in the word count. So that's like a little snapshot of how you write an abstract. And here are some writing tips. So strictly follow the submission guidelines, including the word limits, formatting, and deadlines. I believe that there was a PDF that was shared with these instructions, so make sure you follow it very carefully. Cut filler and jargon. I think, in the very first couple of drafts, right, we write, it's very normal to write with a lot of filler words, and it makes sense to, when we're brainstorming, to be very open, to just write what you think. But then in the additional reiterations, you want to start like really honing down on what words do you want to use, because space is limited. So be as concise as you can and cut the words and phrases that are not necessary. Proofreading is really important, making sure that your abstract is free of errors and typos before submission. Grammarly, I'm sure many of you know about it. It's free, and you can, there's a link to this here. It's a free tool to check for like grammar errors, spellings, and punctuation. And then the more you can submit early, the better. Just because the stress of it all, makes it harder, but the earlier you submit gives you more time to actually review, maybe have a colleague, give you feedback and so forth. And some common pitfalls: be specific. The reviewers need clarity on your findings and their importance. So what often helps me is to have someone who maybe doesn't work that closely with me review my abstracts or my work, because then, they don't go in with any kind of pre-assumptions of understanding what I do. So then they can really give me feedback on, is my writing clear? Does it explain, the theory of change of like why this leads to this, right? So they can really help you understand, is your writing clear? Are you explaining why you think, you're observing this outcome as a result of what you've done. Omitting results. So sharing results, even if preliminary, is really helpful for conference organizers to assess whether it's something they want to show. Impact is often helpful beyond process, I think. Exceeding word limits. So, they have a limited number of pages they can print, so stick to the prescribed word limits. And then early submissions allow for revisions and reduces stress. So just reviewing for this conference, the abstract submission deadline is the 15th of July at 11:59. And they say that they will write you back by the 22nd of August on whether your abstract has been accepted or declined. And if it's accepted, they will let you know whether it's an oral or a poster. If you haven't heard from them, the submitting author can contact this email address or call this phone number by the 29th of September. And then the conference is on the 22nd to the 24th of October. So just opening up now, are there any questions?
All right, yeah, thank you very much indeed, Dr. Sharon. There is a comment here that says that why has it taken you so long to share this information?
Me?
Indeed, how much information? Yeah, yes.
Oh, I don't know, but I'm happy we're sharing it now.
Yeah, that shows really how informative this session has been or is. Yeah, indeed, we had a previous presentation before on how to write an abstract, but it hasn't been as elaborative as this. Clearly, thank you very much, Dr. Sharon, for that. We have a question. I'm going to, if you have a question, please raise up your hand. But for now, I'm going to allow Sarah to ask her question. Others who have questions, kindly raise your hand such that I can let you speak. Sarah.
Yes, thank you so much for this session. Thank you so much for having us have this skill. My name is Ainembabazi Sarah. I'm working with Mulago National Referral Hospital. My question goes like, because some of us who haven't submitted because we didn't have these skills. So now, whether you have submitted, whether you have not, because some of us have already been picked to present, to attend the what? The National Motherhood. So is it going to be guaranteed whether you submit an abstract or you don't, you still attend, or we have to submit? It's a must. Thank you.
All right. Thank you, Sarah. Maybe if I can reply that, that is directed to me. Yeah. So the conference, we are targeting people who are looking at changing or working on the safe motherhood agenda in Uganda. Healthcare workers, anyone really, journalists, anyone that really has passion with the conference, with the safe motherhood in Uganda. The attendees, we shall have two aspects. People that would be presenting abstracts or people who will be making any kind of presentation at the conference, and people that will be attending not in the first category. So surely, if you have been selected, you can attend with or without submitting an abstract. Sarah, I don't know whether I've answered you rightfully. Okay.
Yeah,
Fred,
you have answered me right.
all right. Fred, over to you, please. Fred Magala. Fred, you can unmute and speak. Fred, you can unmute and speak. All right. Yeah, looks like we have no any other question. If I could check in.
Excuse me.
Yes, please. You can go ahead and speak.
Oh, thank you so much, moderator, and thank you so much, Dr. Sharon. I am just kindly requesting if she could show me again. I missed that slide on discussion and the guidance.
Yes, this one, the description one, and then we have one on conclusion.
Oh, the one before this conclusion one.
Description. This is the program abstract, so it's a bit different from the research abstract.
Ah,
Yeah,
okay.
yeah. The research abstract has a different structure.
Thank you so much.
You're welcome.
Yeah, maybe if I can still talk a little bit more about that. So yeah, we'll be receiving two types of abstracts. One is a research abstract for someone that has gone into a field or has gone to the field, collected data. They have their research that has been approved by a research and ethics committee. They have conducted a study. They can send their abstract in terms of a research abstract. Indeed, they have gone to the field, collected data in terms of research. Yeah. And then we have the program abstracts where for people that are doing programmatic work. For example, you are in the hospital and you do a training on how to document death, causes of death. Yeah, and that is something that has activity that has been done in a facility, and you would want to come to the conference to tell us how that activity has improved the documentation of how to write the causes of death in that book. Yeah. So this is something. This training is something that has been highlighting us on how to write.
Nze mbadde nyiize. Now, awakino oseka like in kugaya form.
Research, but you have done some programmatic research.
I like that.
All right. I don't know whether we have any more question, but yeah, we are going to share this presentation after here. We shall be sharing it for those who registered and send in their mails. We shall be sending it directly to the mail. But by and large, I thank you all for attending, and I look forward to receiving your abstracts for the conference that we'll be having in October. And yeah, you could think, Dr. Sharon, you could give your closing remarks, and then we close this webinar.
Okay. Yeah, no, all the best to all of you. Thank you for this opportunity to share on how to do this. And yeah, Thank you so much, and all the best. Thank you.
All right. Thank you very much indeed.
Thank you. Bye.